You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm your host, Kathy Biasi, and I'm an holistic nutritionist and a professional cancer coach. On today's show, we are talking about fatty liver disease with our guest, Dr. Supriya Joshi. In the simplest of terms, fatty liver disease is accumulated fat inside the liver that can over time affect liver function and cause liver injury. And this, of course, can lead to other systemic illnesses. After completing her medical degree at the University of Western Ontario, Dr. Joshi completed residency in internal medicine, gastroenterology, and a further fellowship in hepatology at the University of Toronto. After working at Western Hospital as a clinical hepatologist for a few years, she has been working at the Credit Valley Hospital Trillium Health Partners in Mississauga, Ontario, since 2004 as a gastroenterologist and a hepatologist. She is a lecturer at the Tremerty Faculty of Medicine at the University of Toronto. She enjoys speaking and educating others on viral hepatitis and metabolic health-related fatty liver disease and its management. She is the medical advisor and board member of Fatty Liver Alliance, which is a patient advocacy organization. She has been writing and educating the public about the negative impact of poor diet on metabolic health for years and has been a guest on CBC Marketplace to highlight these issues, as well as an invited guest on podcasts and social media platforms. This is a really important show because fatty liver disease is often undetected in its early stages. And because of the huge impact of diet and lifestyle on preventing or reversing this disease, it needs to be talked about far more. In the show, we talk about the misconceptions of fatty liver disease, what it is, what it's not, integrating medical and lifestyle care for fatty liver disease, and fatty liver disease and insulin resistance, the connection between the two. Stay tuned. This is a great show. We will be back in just a few minutes to talk with Dr. Joshi.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back to the Health Hub. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on all of those locations. Today's show has been taped, so no opportunity for calling in, but you will have all our guest information if you want to do any type of follow-up, and you can always contact us directly if you have any questions about our show. Dr. Joshi, welcome to the show. Thank you so much for joining us.
Thank you very much for having me today, Kathy. Looking forward to our chat.
Yeah, I'm looking forward to you elucidating about this topic of fatty liver disease, about liver health in general. Again, it's one of these things that has been sitting in the background with so many other things. I was just talking to someone about the oral biome, which now seems to be such a huge thing that was, lingering in the back. And the same thing with liver disease and specifically non-alcoholic fatty liver disease. So why don't you take us through your journey? You've got a very large following. So obviously people are very interested in this topic. How did you get to the place where you're at now?
Great question. So I've been in clinical practice for over 20 years at a very large urban hospital in Ontario. And I'm trained in internal medicine and gastroenterology and a further specialization in liver disease. And over this time in practice, I would see many people for whom I had no medical therapy to give them. And these are people labeled with a condition called fatty liver disease, which has now been renamed metabolic associated steatotic liver disease. So that's a mouthful. The acronym is MASLD, or MASLD. And this new name, I think, better reflects the underlying pathophysiology or cause of the condition. So the reason I even started this whole social media journey, even before that, I started writing publicly to the Globe and Mail, the Toronto Star, editorials in my community. And that was because I realized the name fatty liver disease was a big misnomer because people didn't understand what it was, what it meant, and what it could lead to. And to make a long story short, metabolic liver disease is strongly correlated with a condition called insulin resistance. It's often present before someone is diagnosed with high blood pressure, type 2 diabetes, heart disease, stroke, dementia. And yet it's a signal that has been grossly ignored in medicine and by people for decades. And I've come to realize that if people are given this information that connects all the dots for them, then they can learn what they can do, what can empower them to potentially halt the disease process, even reverse the disease process, or even reduce the intensity or severity of the other associated metabolic diseases like high blood pressure, type 2 diabetes, for which really people are prescribed a multitude of medications to manage, and they're necessary medications. But understanding that there's a very important lifestyle modification that people can implement if they were aware on how to do it. So to make a long story short, that's why I started this social media page, to really provide information to people, because I don't feel like it's necessarily readily available or understandable. A lot of doctors will say, well, you need to change your lifestyle, you need to lose weight, and we'll see you in 6 months. And I feel that that's not good enough information to provide to people. And I think giving them more information, education is much more empowering. Then they can learn what they can do. And from me practicing that way, I've seen progress in my patient population. So I'm just sharing it with the public.
Information is so important. I think it's so valuable and so overlooked when we're talking about our health. Just given a prescription or just being told to do what you said, change your lifestyle. If people understood the backstory as to why this is beneficial and why this condition can lead to other health issues, I think a lot more people the light bulb would go off for. So I think the education piece that you provide as a medical doctor. So I see this, this is becoming a little bit more mainstream, that medical doctors are now trying to, bring in other aspects. I know you're on a very tight schedule when you see people. So the fact that you can do this on social media, I think is a great, we have so many down things about social media, but, with you being able to use this platform for the good, I think it's great. Now, I do want to differentiate here. Other than the pathway of getting to a liver disease, is alcoholic, like the differential pathways, is alcoholic-induced fatty liver disease, basically, or is it the same state as non-alcoholic fatty liver disease? Are we dealing with the same outcome, or is it two very different diseases?
I think there's a lot of similarities and overlay between the two, but they're still slightly different. So there's a multitude of reasons why people might have liver disease, and alcohol is one part, and metabolic related fatty liver disease is another. And there's still viral causes, autoimmune, genetic causes that we deal with. But in terms of, and then there's people that have the overlay. They have a suboptimal diet, suboptimal lifestyle, and they drink some alcohol as well. Then there's people who drink too much alcohol, leading to a predominantly alcoholic-based liver disease. And certainly the treatment is similar, and that is stop the offending agent, whether it's alcohol or whether it's ultra-processed food and excessive refined carbohydrates and sugar without adequate exercise. So the treatments necessitate a change on behalf of the person. They have to make a change that needs to be consistent and ongoing and easy to maintain. And I just wanted to say one more thing about your first question, why else did I do this? And that was because I was seeing lots of patients develop liver failure related to cirrhosis from their metabolic liver disease, and there's no treatment. And when patients are in that state, they often could also be a poorly controlled diabetic. They're not very functional, and many of them were not even considered liver transplant candidates. So I was palliating people in their 50s and 60s. And that's just heartbreaking.
Mhm.
So on behalf of those people is why I want to speak up, because when I do educate them about what they could be doing, universally, they all said, I wish someone told me this 20 years ago.
Can
And
it be
that's
reversed?
ignorance was bliss.
Well, yeah, I think you're right. Well, I think it was a different mind state as well. I think the push to a more integrative type of healthcare has been mind-boggling, eyes wide open sort of an approach. What are the signs and symptoms of a fatty? Actually, the question I just meant to ask you, can it be reversed with diet and lifestyle? Can this disease be reversed?
Yes, that's the amazing part.
Wonderful. Now let's get into signs and symptoms of fatty liver disease, because I think it can get, just reading some of your material, I think it can get pretty far along without anybody having any idea that they have the disease.
That's exactly the problem. We have no guidelines in North America or the world yet for how to screen for fatty liver disease. So there are people don't say, I think something's wrong with my liver. That doesn't usually happen. So there's often no signs, no symptoms. Sometimes people will have an ache in the right upper quadrant where the liver sits. Only if the liver becomes a little enlarged and distends the capsule around it, that can sometimes cause a dull ache that gets them to their family doctor, that lands them blood work and an ultrasound. And often that's how it's diagnosed. Otherwise, people are getting routine blood work and their liver enzymes may be elevated. But I've also seen that many times with severe fatty liver, when I further work those patients up, their liver enzymes can in fact be normal. Mm-hmm. So it's clearly not the best screen. So I do recommend, if people already have a diagnosis of high blood pressure, type 2 diabetes, or they're overweight, to get screened for fatty liver disease. And the most simple tool would be an ultrasound at this point, because that is covered by OHIP, but other tests do exist, like a liver scan. And that's another non-invasive test that quantifies liver damage or fibrosis, as well as the grade of fatty liver, which would be mild, moderate, severe. And this is a test that people pay out of pocket for. It's not covered by our insurance plans, but it gives patients a good sense of where they're at on that spectrum of disease from fatty liver.
Is it common to have some fat on or in or around the liver? Is it a common thing?
It has become exceedingly common, but it's not normal.
Okay, so your liver should have no fat in it, around it, on it at all.
Well, there's normal like fat cells within connective tissue. So that is normal, like in terms of how the architecture of what holds our organs together. What's not normal is fat within the liver cells and between them to that degree. That is completely not normal. And that leads to liver cell inflammation and scar development.
Okay. Can you get to a place in your own mind, if you understand some of the big functions of the liver, and then, pair that with the fact that some of these functions may not be as on point as they should be, could that be a sign of perhaps the liver not functioning? For the one, let's take detoxification, how important it is for detoxification. Is there a way for us to put a handle on this isn't working properly? It could be my liver.
I don't think there's something that people would detect.
Okay.
The liver functions at a very efficient level for very far along, even in patients with cirrhosis. You'd never guess they had liver cirrhosis, which is severe scarring of the liver. Their blood work would most often still look normal. The liver is still detoxifying normally, but that liver is particularly sensitive to another new injury. So that's how the liver is very robust. It can get away with a lot.
Interesting. Now, when you talk about high blood pressure, you talk about cholesterol, you talk about insulin resistance, are these things that can lead to liver disease, or does a liver disease lead to these symptoms and diseases?
I think all of these organs, like the liver, the blood vessels, the heart, the kidney, the brain, they're all victims of insulin resistance, which is a systemic problem that the liver is primarily involved with, as is the pancreas and probably our gut as well. So it all starts with what people are consuming with digestion. whether it's in the liquid form, food form, and then it's how much people exercise, move their bodies, what their muscle mass is, how their sleep quality is, how their stress levels are. So there's multiple factors that relate to all of these conditions. And certainly there are other diseases of the blood vessels like high blood pressure that can occur without insulin resistance. Same with heart disease and kidney disease. But when someone has all of those conditions, it's often related to underlying insulin resistance. And usually, to answer your question, the liver was usually affected first.
Interesting. Now, I think it might do us a service if we go into just a little bit of what actually insulin resistance is. And perhaps if you could just give us, in broad terms, how we get to this point.
Excellent question. So in the normal state, we need insulin. This is a hormone that's produced by our pancreas, and it is essential for life. People often know this from a condition called type 1 diabetes. From those are people that at a young age are unable to produce insulin, and they're at risk of death if they're not given insulin injections. So that's a separate issue. When it comes to insulin resistance, this means that our body's ability to respond to insulin is becoming impaired. So to keep it very simple, I'm going to simplify this complex system, but when we eat or drink something that contains glucose, and there are such as a can of Coke, which has 39 grams of sugar in it, or a bagel, which can have a lot of refined carbohydrates but doesn't taste sweet, or a bowl of rice. When any of those things are swallowed, digested, and brought down to the gut level for absorption, what your body sees is glucose. It doesn't know where it came from. So that glucose now gets absorbed across the gut wall and into the bloodstream. But glucose is not supposed to stay in the blood. It's supposed to get into the cell to power the cell. Well, our body's brilliant, and every cell has multiple protein channels. And for the glucose door to open on the cell, you need the hormone insulin. So as the blood glucose rises, the pancreas receives the signal to secrete insulin. Insulin opens up that cell door, and glucose goes in to power the cell. That's normal health. But when there's excessive glucose in the blood, essentially the cells start to ignore that insulin response. And now that's called insulin resistance. And that extra glucose needs to go somewhere. So now it's converted in simple terms into fat and stored in the liver as a future energy source. So liver fat or body fat, wherever it's deposited, is essentially stored energy waiting for your body to need it. But when we're in a state of ongoing consumption of more and more glucose, more and more refined carbohydrate, and not exercising or burning that energy, then our body will continue to save that glucose for future energy, kind of like waiting for us to have starvation, which doesn't seem to happen in North America or communities of excess. And so that's basically how disease states start. So you get liver or hepatic insulin resistance, and there's multiple feedbacks going to other organs in the body, including our muscle, our pancreas, our gut. And this leads to impaired glucose metabolism.
Have you ever initiated an insulin sensitivity test to any of your patients?
I have not. Many times a family doctor has, or the endocrinologist has, but it's not something that I routinely order.
Is this becoming, I had this done when I was going through my health issues. I had this done, I had to pay for it out of pocket, and it was not an easy test for me to hunt down. Is this to me that it is such an important test, more than a blood sugar test, because you can have your insulin pumping and keeping the blood sugar at the level it's supposed to be, but it doesn't mean that the insulin level should be that high. So is it, in your estimation, one of these, how vitamin D has now become, yes, we should get that tested, that's becoming mainstream. Insulin sensitivity tests could be a brilliant segue into understanding disease. What are your thoughts on that?
I think it's a possibility because it's not something that I standardly order, as you've correctly mentioned, not necessarily covered. So I don't pursue that. But I have done fasting insulin levels on patients just to correlate for them what it could be. And if it's high, it's quite clear. But also if their hemoglobin A1C, fasting glucose, triglycerides are high, or waist circumference is elevated, I already know they're well on their way. And I don't need to wait for any other test to kind of tell them it's time to make some changes.
Yeah. So, okay. I don't want to get into too much of this before we hit our break, but you did touch on the topic of fasting. Is this something that, again, is this something that you give people, the tidbits of information and look at it? Because you have a lot of information that you're giving us right now. I can't imagine you have that amount of time when you're seeing your patients. How do you lead them into the fasting and the reason for fasting in certain cases?
Yeah, well, I explain actually to most of my patients exactly how I did to your audience about insulin resistance and glucose metabolism in a very abridged form. So I explain when the liver's full of fat, but it'll keep building more fat if you keep consuming. That's my segue into explaining how fasting works. So by taking a break on that consumption mode, when your body is fasting for at least 14 plus hours, then your cells need energy. And they can get it from that liver fat and reversing it back into a usable form of energy. So that's how I explain it to people. And then they go, aha, now that makes sense to them. Mm-hmm. And the other reason I like intermittent fasting is I think it gives some people the mindset for boundaries of eating windows that works for some people. And my job is to provide a whole toolkit to my patients, and they can pick and choose what works for them. And how fast they're wanting to reverse this metabolic disease. So I recommend, if they can do intermittent fasting, ideally 16 hours fasting, 8-hour window. And that helps people also minimize late night eating, which we also know is not good for metabolic health due to circadian rhythm and other hormones and peptides we have in our bodies. I don't have time to go into those, but like ghrelin and leptin, those play a really important role in our appetite and satiation, or how we feel full. And late night eating can make people actually feel hungrier the next day. So it's not to someone's advantage to have a snack late at night, especially, those snacks people eat aren't often nutritious. They're usually comfort foods. People are eating out of boredom. So it's realizing that mindset on why are they wanting to go back to the fridge or the cupboard and changing that.
Mm-hmm, mm-hmm. And you touched on circadian rhythm. That's come up in so many different spaces. If we just stayed in tune with our body, we could, really avoid some of these pitfalls that we're falling into. Do you recommend a specific diet for people?
I don't. What I explain to people is I want them to have real food, avoid ultra processed food, avoid refined carbohydrates and sugar. So one of my first interview questions always is, do you drink coffee or tea in the morning? If so, how many in a day? And what do you put in it? And often that's a quick gauge for me on what they're doing. So if they put their 2 spoons of their sugar in their coffee every morning or their tea, I know that's going to be a problem. And they're starting their day with sugar. And one of my pieces of advice is to not start your day with something sugary or dessert-like. Start your day with something savory, if you're not going to pick fasting, and otherwise your option is to skip breakfast that day. But you can have coffee or tea, but preferably have it black, is my suggestion. And so in terms of diet, whole food, real food, I recommend sequence of eating, starting with your fiber and your vegetables, followed with your protein and healthy fats. If you still want a carbohydrate or like a refined carbohydrate like rice or pasta or bread, have it at the end. And that sequence has been shown to lead to improved post-meal sugar spikes. But in addition, if you start eating your meal that way, you might naturally feel more full and have less of a craving or need to have that rice or pasta at the end. So when it comes to food, I recommend whole food, real food, Mediterranean style diet, because that's an easy name for people to understand what that could be. And otherwise, I think putting food in the category of bad food, good food, I think can be sometimes harmful for some people. So I just want them to be educated on why you want to minimize or reduce that food group and elevate this, like elevate the fiber and the protein, minimize the sugar and refined carbohydrate, and understanding a treat's fine. A treat is good, but you don't have to have it every day, and certainly not at breakfast.
Well, and that just, I totally agree with that approach, because let's face it, we are human. We're going to go through ups and downs of perfection in our diet. But I think, again, this education piece is so important. And it's so nice that someone in the medical field is pounding that drum and trying to get people to understand the whys behind the whats. Anyways, let's take a quick break here before we get into, lifestyle habits and things like that. We're going to get into the good part of the show where we can actually improve liver health. Everybody, we'll be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub. We are talking with Dr. Supriya Joshi, and we're going to get into ways that we can actively improve liver health. And let me first put out there, and to you, Dr. Joshi, these are things that if you don't have liver disease, if you don't have an issue with the liver, we should be putting in place anyways. This is also a prevention path, is it not?
100%. Why wait for a disease to develop and then make those changes? Just live your life in a healthy way, and you may, be able to prevent yourself from ever being diagnosed with a multitude of medical problems. And we're also learning this plays an important role potentially in our longevity, our health span, which is a term that means living long, but living healthy, being functional versus being older and not functional and sick on multitude of medications. You can avoid many of these lifestyle-based diseases. Like, why not?
Absolutely. Before we get into the lifestyle and that piece of it, I did want to touch on liver disease, specifically with females, hormones, menopause, changes in cycle, changes in life stages. Is there an area, women have to deal with hormones and some of the things that go along with fluctuating hormones throughout their life. Is there a correlation between any cycle of life and the increased possibility of fatty liver disease?
Excellent question. And you're right. It's women that are affected by this due to natural occurring hormones compared to men. And when it comes to women, an extra subgroup that we see are women with PCOS, or polycystic ovarian syndrome. Okay. They have, through their own hormonal imbalances, a higher risk of insulin resistance, as are perimenopausal to postmenopausal women. And so, in fact, there was finally a study looking at this that was published last year that found that women who are postmenopausal have a 2.4 times risk higher of developing fatty liver disease compared to premenopausal women. And this was certainly something I've definitely been seeing in over 20 years of clinical practice. And this really supports that the effect of a decline in estrogen, testosterone may be playing a role with liver health as well, and their insulin sensitivity as women age. So the same things that I recommend to all my patients with metabolic liver disease is not any different for my women with PCOS or who are menopausal. Is pay attention to increasing protein and fiber, minimize the refined foods, processed foods, but particularly I really want them to strength train and build more muscle, because the more muscle we have, the more metabolically healthy we'll be, because glucose is separately metabolized in the muscle. So the more muscle you have, the better your blood sugar balance will be. And as we all age, as you know, we lose muscle mass per year. So I think it's an important thing that we all pay attention to, because the way people's jobs are in the modern world is we're not lifting as much, we're not moving as much. Many people's jobs are on a computer and are sedentary. So I think our health is declining related to that particular lifestyle issue.
What about during the month-to-month changes of our hormones?
It could certainly play a role. I can't say that mid-cycle someone's liver health is any worse or better.
Okay.
Because I don't think that's been looked at. And in addition, I think the liver is a very slow organ. I tell people, it can take years to develop. It can take months to years to improve when it comes to metabolic health.
Now, the liver does regenerate. So there's hope for that, hope that is going to regenerate in a good way. So I think it's important for people to understand that there is potential, there is hope, there is, a way down this pathway. Now, you've talked about strength training, you've talked about diet. How does sleep impact our liver?
Well, we know that inadequate sleep can raise cortisol levels, can raise blood sugars in the morning. It can make you also more hungry the next day and makes you feel more irritable. And when people are more irritable, they tend to seek comfort. And those comfort foods, again, tend not to be the healthy ones. So when you don't get enough sleep, it feeds into that whole issue. And then there's another question. Well, why didn't you get good sleep? Were you eating late at night? Do you have sleep apnea? And it's one of my questions I ask everybody. If you're not getting good sleep, have you been screened for sleep apnea? Because that's also in keeping with insulin resistance, and treatment of that sleep apnea can lead to better sleep quality, which can lead to improvements in cardiometabolic factors that we all look at in people with metabolic disease. So sleep has a few different ways it relates to how people feel during the day.
You mentioned cortisol. So when we hear cortisol, the lights flicker on and off for stress. And stress, people, you should really be happy that it's these same things that keep coming up in all areas of health. So, again, with liver health, we have, the stress implication, but can you draw the line for us between the mechanism of action between stress, cortisol, and its impact on the liver?
Great question. I wish I could answer that for you, Kathy, but I have not seen a study, I'm sure there is a study, but I have not come across it to explain that.
Okay. All right.
To me, it makes sense though. It makes sense to me that it does exist. And I think doing everything we can to get good quality sleep and have better stress management skills, I think will help people in all aspects of their health.
Well, just going back to the circadian rhythm, and, cortisol and melatonin are two big parts of the properly functioning circadian rhythm. We can see why sleep is so important in that aspect of liver health. Now, a lot of people, January the 1st, turn to detoxification, and liver detoxification is like just really high on the things that we want to detox first. If you're living a healthy life, your liver should be detoxing well. If you are not living a healthy life, do these detox plans work in your estimation?
No, I mean, what they are selling is a false claim. And I tell people these detox supplements that people are getting, it could interact with your medications. It could cause liver failure because it contains a herb in it or a contaminant in it that could make you sick. And I've seen that multiple times a year. And what I want people to get the message is that you can't take something to undo the damage caused by other things you've done in your life. It's not going to work. And taking a detox for 60 days is also not going to fix anything. So really, as you've already said, Kathy, living a healthy life, treating your liver well all the time is the best strategy. And that means minimizing alcohol consumption. As you know, Canada did release an announcement last year that there's no safe levels. And if you are going to have a drink, it should be under 2 a week. Anything that's 3 or greater a week is associated with increased risks of blood pressure, heart disease, dementia, and even breast cancer, and increased risks of other cancers as well. So regular alcohol intake is not the blissful thing that was thought of a decade ago. So minimizing alcohol is really important. And as we age, we metabolize it less efficiently for several reasons. So that hangover effect with less drinks is noticeable by many people over age 50. So cutting back is key. And then just, again, it's about minimizing fructose and extra sugars and refined carbohydrates. Keeping that minimal is, I think, the best advice I can give people to keep their livers healthy. And of course, keep active, keep moving in any way. If you can't work out today, that's fine. Walk around, climb some stairs, and make a better effort tomorrow if you can.
Well, I think the movement piece is also something that I've seen so much talk of in the last 6 months. The importance of movement, the importance of getting out, walking. And I think that's playing a lot now with people. But the idea of strength training and the development of muscle, I actually, I can't remember where I saw the study, but they talked about, we buy into this thing that muscle decreases as we age. That is true, but that does not necessarily mean that we can't maintain a very, very healthy level of muscle mass. And to that end, it's never too late to start.
Exactly. And you can still build muscle. If you do
Absolutely.
nothing, it will continue to go down. But if you move it and use it and build it, you can definitely have an excellent muscle reserve as you age and go into your upper decades.
And, part of the reason that muscle mass declines as we get older is we do stop doing things. For women, we're active usually in our younger years. Then you have children and you're carrying and you're picking and you're running, and then those children get older. And I think there's this gradual slowing down as we age. And it does take effort on our part to figure out where we can put in the exercise that we need. And that's a whole other area of conversation for sure. But you did talk upon, and we didn't go back to it. One of my things that I just love to speak about is the association of the liver and the gut. Again, I know this is a huge topic, but with respect to what we're talking about here, can you give us an overview about having a healthy gut microbiome and how that impacts the health of the liver and vice versa?
Absolutely. And I'm a gastroenterologist as well. So I would previously see a lot of patients with irritable bowel syndrome, bloating, and it's the same diet. It's the same recommendations. There's really nothing different. So gut health is liver health, is metabolic health. Mm-hmm. Whatever you feed your body will have manifestations throughout it. So I think, again, it's keeping down the garbage, the processed stuff, the refined things, and the glucose, because all of that disrupts the microbiome. We all have most of the cells in our body are bacteria, which is an odd thing to think about, but it's true. So we have that much bacteria in our gut that's processing, metabolizing, digesting away all the things we're technically feeding it, the microbiome. So you want to treat it well, because when you shift your diet to be, let's say, a poor diet filled with fructose and refined carbohydrates and processed things, then that can lead to an overgrowth of other bacteria that can cause more secretions, and that can lead to gas formation and discomfort or loose stools. So definitely there is a connection. I don't know, no one knows exactly what is the best diet, but clean eating, healthy foods, minimizing processed stuff is the general key for everything. And I know for myself, I just want to make things simple, doable, accessible for my patients and the general public. Things should not have to be so costly that they can't afford it. And things are so expensive right now. So I think keeping it simple, you don't need a magical supplement to take. Eat well, and your body will reap the benefits.
Which leads me to my next question. Are there supplements that you are particularly fond of, or do you think they have value at all?
Yeah, no, great question. So my mantra is to really keep things simple. Mm-hmm. And living in Canada, and I test you've already mentioned vitamin D, and I screen everyone for vitamin D deficiency, and it's present in about 95% of my patients, if I took a guess. And I think living in Canada, where we're covered up most of the time, we don't necessarily absorb the vitamin D through our skin. And this applies to people who have white skin or shades of brown. People with darker shades of brown absorb it less well than people with less melanin in their skin. But even in people who, as I mentioned, who don't have brown skin, their levels are also very low. So I think in North America, screening for that's important, and it's an easy thing to supplement with. Vitamin D is an easy thing to take with potentially significant benefits. I know there have been some controversial review articles that have been out there, but I still believe that it's an easy thing. And data has shown that even in people with fatty liver disease, abnormal liver enzymes, vitamin D supplementation can improve that. So to answer your question, I do recommend vitamin D, 2,000 units a day. I also recommend magnesium glycinate for patients. I recommend vitamin D with their meal, because it does need fat to be absorbed with their meal. And then magnesium at bedtime, because it can help with sleep. It can help with restless legs. It can help with gut health, bone health, and even brain health. And it helps the vitamin D absorption and mechanism of action in the cell. So those are the two things I recommend for people to take if they can remember. And if people also have high cholesterol, I recommend omega-3 fatty acids, especially if they're not getting that naturally in their diet. So those are the main things I recommend. As I said, I want to keep things simple for people rather than being on a multitude of capsules they are told to take and then don't take anything.
Mm-hmm. I totally agree. Are you seeing the fruits of your labor in practice?
I do. I love the feedback I get from my patients. I absolutely love it. So I know it's working. As soon as I realized explaining the how to people, I couldn't believe the engagement I received from them and the results that I saw from them. I'm a very busy community physician. I'm a mom of 3 kids, got a busy life. So have I had time to do a study? No, I haven't. But it's definitely my observation that patient empowerment works, and I'm all for it. If that reduces the risks of progressive liver disease, and I prevented someone from developing cirrhosis and liver failure, needing a liver transplant, I'm thrilled. But one thing I tell them is that actually, for many of them, I'm actually not worried about your liver disease. Yes, you have fatty liver, but you have no liver fibrosis. But I really encourage you to make these changes because yes, you have fatty liver, but you have a high risk of developing high blood pressure, type 2 diabetes, and potentially heart disease in the future. So if you can maintain these changes now, not only will you reverse your liver disease, but you may also reduce your risks of the other associated metabolic conditions. So that's my hope for people after we've had our assessment.
We are and this, I guess this will be the last question, sadly. We are a highly medicated society. Does that impact our liver greatly? Yeah. I don't know how to end that one. Yes.
Yeah, no, definitely. I mean, every potential medication will have a potential side effect. So we have to look at that carefully. And most people I see are already on medications for some other disease. And that's why I really do show concern about herbal therapies, detoxes, because I've seen drug interactions, multiple times. So when I see these people on medications, they definitely need those prescriptions to risk reduce whatever diseases they have. And the ones that are at risk of causing liver disease, I'll monitor them or suggest that one be discontinued and we switch to something else.
Okay. Perfect. The cholesterol one, I know that there are warnings for the liver, certain types of cholesterol medication. And I know that a lot of people are on that. So that, again.
Not to interrupt you, but if people have high cholesterol, they need to be on it. And liver health typically will improve because most people with high cholesterol also have fatty liver disease. And the cholesterol medications have been shown to improve liver health as well for the majority. I think the side effect of causing liver issues is quite minor.
Oh, that's very good to know. That's very, very good to know. I haven't heard that before. So terrific. If people want to find out, you're in private practice, so you are seeing patients, obviously. Are you still taking patients or are you tapped out? Are you full?
Absolutely. Yeah. My office is primarily, my interest is liver disease. That's a majority of what I see in my practice. I see patients virtually and in person. And I'm in the Mississauga area in Ontario.
And do people have to be recommended to you from a GP?
Yes, as per OHIP Ontario Canadian health law, yes, referrals necessary.
Do you take preventative cases?
Well, I think that's kind of what's already included in that. I know if the family doctor is concerned because fatty liver was seen in imaging or liver tests were elevated, that's the kind of referral that's often sent to me. Then I work them up and I will give them recommendations to prevent worsening. So from that point of view, yes, but otherwise, not right now, although I am considering potentially creating another stream of my practice that's non-OHIP that might embrace some of the things you're leading into.
Wonderful. Can you let us know your Instagram site? You're on TikTok as well, and your website.
Yeah, so I primarily am more active on Instagram, and that's at Liver Health MD, like medical doctor, and look forward to people's engagement. I hope the site helps them. And that's where people can find me.
Well, I want to thank you so much for being on the show. It's such an important topic. And having the information come from the medical space, it does carry a lot of clout. So I think it's really important that your message is being shared with as many people as possible. So I do really appreciate the time you spent with us today.
My pleasure. Thank you so much for giving me the opportunity to have a chat with you about this very important topic. Thank you.
You're welcome. Everybody, we'll talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.